Good day, everyone. My name is Maria Lourdes Vistar, and today I am going to discuss the story of Josephine P. Tesario entitled Young Jason Wage Battle Against Hydrocephalus. Paul Jason Vellion was barely 2 months old when the doctor detected that he had congenital hydrocephalus. Now he is already 3 years old and his situation has worse. His head continued to grow bigger because of the large amount of water in his head. Jason's case is different from those children suffering from hydrocephalus. He has multiple congenital anomalies. When he was over a year old, Jason underwent an operation to correct an intestine malrotation, a medical situation in which the intestine are intertwined with other internal organs. The surgical process called exploratory laparotomy means opening up the abdomen. It had been very difficult for the fragile Jason to have such an operation at the very tender age. He survived, although it was only the start of his many battles. Since his anal opening was very small, his intestine had to be placed outside his abdomen so he could still degas and discharge waste. He became malnourished because his body could only take in so much milk and infant food. If he ate too much, he would throw up. So the case of Jason is very difficult. Extreme pressure held today in the year 1998. During 1998, hydrocephalus in one of the most common birth defect affliction more than 10,000 babies each year. The major cause of hydrocephalus is the obstruction of the cerebral aqueduct, which is the natural draining point for fluid in the brain. The condition may be brought about the prematurity of birth, spinal bifida, brain infections such as meningitis, head injury, brain tumors, and brain cysts. Genetic causes are extremely rare. Fact and figure of hydrocephalus. Studies by the World Health Organization show that one birth in every 2,000 result in hydrocephalus. More than 50% of cases are congenital, as many of 75% of children with hydrocephalus with some form of motor disability. Over the past 25 years, death rates associated with hydrocephalus have decreased from 54 to 5%. Intellectual disability has decreased from 62 to 30%. Chance malfunction occur in about 2 to times in the first 10 years of use per patient. 95% of infection occur within 3 to 5 days of surgery. Shunt function occur in about 2 to 40% of cases. Ocular gaze and movement disorder are found in approximately 25 to 33% of cases. Hydrocephalus occurs in 70 to 90% of children, with the most severe from the spinal bifida. 90 to 95% of babies with spinal bifida and related defect are both two parents with no family history of this disorder. Common problem associated with hydrocephalus. First one is visual. So visual impairments that influence the upward gaze and ocular movement affect 25 to 30% of children. Depth percentage is also a common visual impairment. Second is motor skills. As many as 75% of cases have some form of motor disability. An individual with a short can participate in most physical activities. However, he or she is advised to stay away from raw contact sports, particularly those that require the use of a helmet. Some other physical complications that are something associated with hydrocephalus are sensitivity to pressure, sound, and a bright light. And the third one is learning disability. There are the common complication individual are able to learn. However, modification in teacher strategies are required. Two-thirds of children with hydrocephalus do have at least borderline intelligence. A problem related to learning disability is the inability or deficiency in memory retention. However, with special care and attention, they achieve their fullest potential. As a result of the physical application of the disease, it is not uncommon for psychological effect to set in. And that's the end of my report. Thank you, and I hope you learn a lot.